Hi, and welcome everybody to the next panel, which is focusing on the challenges of multisectoral nutrition, the implications of multisectoral nutrition programming. All of us have confronted the challenge of nutrition falling squarely between or bridging health and agriculture and food systems, and I'm looking forward to three wonderful presentations and leaving a chance for robust discussion. My name is Bea Rogers. I direct the Division of Food and Nutrition Policy and Programs at Tufts, and I would like to introduce, I think I'm going to introduce the speakers now, and then we can just go 1, 2, 3 when the panelists begin their presentations. The three speakers today are Neena Joshi, who is a development professional who works in the field of community development. She's director of programs at Heifer Project International in Nepal and provides leadership in program development and management targeted toward alleviation of hunger and poverty and care for the earth, bringing many important dimensions together. She has been engaged in various research works relating to social capital, child nutrition, and gender, and bringing them together in program designs. Nassul Kabunga is an evaluation research economist affiliated with the Friedman School of Nutrition Science and Policy here at Tufts University. He holds a PhD in agricultural economics and rural development from Göttingen University in Germany, and a Master of Science from Hannover University, also in Germany, and a Bachelor of Science from Makerere University in Kampala, Uganda. Over the past year, Nassul has been working as a consultant at the Uganda National Information Platforms for Nutrition to build capacity of national institutions in compiling and analyzing existing data sets to provide evidence-based policy and program interventions to improve nutrition outcomes in Uganda. And if we had any question about the importance of understanding applying data, we have certainly understood that this morning. Sonia Zaharia is a postdoctoral fellow at the Nutrition Innovation Lab with a background in economics. Her interest lies at the intersection of economics, agriculture, and nutrition with the aim of finding sustainable solutions to global food security. She has a Master of Science in Sustainable Food Systems from Wageningen University and a PhD in Finance from Goethe University in Frankfurt. So welcome to our fabulous distinguished panelists. And I will turn the agenda over to Neena Joshi to begin her presentation. And thank you. My job, unenviable as it is to keep people to time. So with that, I will say welcome, Neena, and thank you. And unmute yourself, Neena.
Thank you, Beatrice. Thank you for having us here and reflect on the journey that we had together with Nutrition Innovation Lab and the lessons we learned. Next slide, please. So Heifer works with the mission to end hunger and poverty and care for Earth. Next slide. In 75 years, we've reached to more than 35 million families across the world and equipped them with tools to lift themselves out of poverty. Next slide. Our works evolves around agricultural value chains. It starts from input side, production technologies, linkages to market, reaching to consumers, along with like helping the communities in the social dimensions, the community development, community institutions, the social capital, and also the market side of things. Doesn't have a core component of a nutrition component. Next slide. And we started our journey with NIL, trying to understand does our work, like what nutritional impact does it bring, like to child growth, diet, and when there's not a definite core component of nutrition there. So that was our first project that we did with NIL. And second, we also looked at what part of Heifer program is important to child nutritional outcomes. Next. We quickly saw that there was a need for a specific focus on the nutrition work that we did. Though we produced food and talked about consumptions, we did see very quickly that there was a need for focus. So we developed nutrition curriculum, looked at behavior changes tools, had nutrition indicators specified in the programming we did. Next. We did see that intervention works. Improvements in income, improvements in wealth. Next. And the diet diversity improved, the consumption of ASF improved. And there were improvements in undernutrition. Next slide. And one thing also that was very clear was these growth outcomes, the impact in nutritional growth did require a long span of time to show up as an impact. Next. So we quickly took all these understandings of the work that we did into our programming in Nepal and across all the countries that we worked around the globe. And the next question that we wanted to look at was what component of our work was the most important when it relates to child outcome? Because the work we did is complex, it had various components, like it's intensive, like it talks about agriculture production productivity, market, and other technical trainings, and it spans across a long period of time. And there was a big piece about community development where we organized people, helped them come into community organization, build a social capital. So we were always asked with questions that these are expensive, these are labor intensive, these are time taking. So we really wanted to look at, can we have one of these let go? Like, can our program be like focused on specific component? And this was a very burning question for us because we got asked a lot of time, these are labor intensive, these take time, these are very costly, and so on and so forth. So we did a study across the years. And next slide, please. And we did clearly see that the full package of Heifer interventions, which had a very strong component of community development, working with people, trying to change their mindset towards the work they do, and bringing them into community organizations, and then like exposing them to technical inputs, like that was across agriculture, across market linkages, across nutritional messaging, and that was tied with the behavioral element. So that full package of work we did have a very strong results in all the dimensions that we're looking for. So it has a very strong positive outcomes with this full package. And also that the partial package where we just looked at the technical trainings, both in the agricultural side and the nutrition side, that was the partial package we did, that was something very close to control. So it did validate that the full package and the comprehensive piece of work was impactful in terms of the outcomes that we're looking for. Next. So it clearly showed that being in full package Heifer program predicted better growth. It predicted better improvement child diet quality. and greater improvement in child health, whereas the partial package was very close to what control was. Next. So it brought us so this was, it gave a lot of, it gave us a lot of confidence in the work that we did. Like the work that our association with lab has helped us bring this research world and the extension together. So a lot of questions that we were always asked, we had a very definite answers for those. The anecdotal stories we used to tell was backed up by strong evidences. We are now better prepared with solid evidences as we work along with the government, and are better prepared to advocate. Usually, professionals in food production side, they are very tied with productivity, economic change, and that's market side of the work that they do. Though food production is a main piece of nutrition, I mean, these professionals in the food production side are less likely to talk about nutritional outcomes. So this work that has been done has equipped us to engage with the government, policymakers, and as well as other extension workers like us to look at the nutritional outcomes of the work we did. We are better prepared with solid evidences, and we have ways to better articulate the work we do, and then need and clear evidences of how it links together. We looked at various dimensions of the work we did, like the women's education, the wealth scores, their asset level, the livestock score they had, and how that related to the nutritional outcomes. So we have been we have created a wealth of knowledge that has prepared us to do better programming in terms of creating better nutritional impact, and also prepared us to engage with the policymakers and the government in a better way. So I take this moment to thank Nutrition Innovation Lab to help the extension workers talk to the researchers and use this knowledge in programming and advocacy and policy changes. Thank you. The next presentation we have Nassul. It's over to you, Nassul.
Thank you. Thank you for keeping to time, and over to you, Nassul. And please unmute yourself.
Okay, so you can hear me now?
Yes, thank you.
Okay, so thank you very much for giving me this opportunity once again. And yeah, I'm really excited about, of course, where we have come from and so far where we are. There have been lots of discussions, and I want to thank my colleagues who have helped backstop the work since 2012 when I started on this journey. And I'm glad that we can still work together and we're going forward. So when we started out, we wanted to conduct a large multisectoral agriculture nutrition initiative, sort of like evaluation system in place. And we were really targeting or working alongside the Community Connector program that was also supported by USAID in Uganda. And so to say, we had a component of implementation research, but then also we had other nuances that we wanted to find out. But naturally, we wanted to find discover what kind of relations that we know naturally exist, but what kind of those linkages that you can be able to draw, pathways from agriculture to nutrition and health, and possibly also back to agriculture, as in you get food from agriculture and then you get healthier, but then also you provide labor back to agriculture, and at the same time, agriculture itself can be a problem to your own health. And why would this be important? Because then we are able to address certain really issues that are central in improving the welfare of most especially the vulnerable populations. And that would include, issues like poverty, poor diets, child stunting, anemia, among so many others. We also wanted to interrogate why the why question. Why are people poor and why are some malnourished? And why would a man beat his wife and issues to do with domestic violence? What really drives that? Then, of course, would want to examine the change. What happens when the change comes? These innovative interventions, technologies, or packaging of messages, and so on. If they can be brought in by the community connector, for instance, then what actually changes and what kind of behavior should be promoted against the pathways that are laid out in the original plan or the theory of change that, for instance, the community connector had. And then ultimately would come up with recommendations for the study area. And of course, this would have implications for, countries or communities in similar contexts. For instance, for the case of a country like Uganda, you look at Uganda and then you can imagine that people and environments and agrosystems are almost similar to what, for instance, is happening in Congo, but you have not had a chance to go there and conduct the research. And of course, then at the end of the day, it would also be interesting to know the social cost or the economic cost that is involved. But I put that in red because we did not have a chance to do that. But that's something that we can always, of course, discuss going forward. Next slide. So the community connector was really multisectoral in nature, funded for 5 years, and the ultimate goal was to reduce malnutrition among the most vulnerable populations in the rural areas of Uganda. And the point of intervention was not at the household level, but at the community level, so to say the parish. And the entry point that would be through social groups, including women's groups, agriculture groups, or farmers groups, and youth groups. And then the choice of interventions, we are really cutting across from agriculture to health, to nutrition, technologies, messages of extension and behavior change communication, among others. Next slide, please. So as you can see from this slide, we have a map of Uganda, and the study itself was focusing on 15, the implementation was in 15 districts in northern Uganda and southwestern Uganda. And these were the districts which were considered to be having high prevalence rates of poverty and malnutrition by 2012, as per the DHS of 2012. But then out of these, we selected 6 districts, 4 in northern Uganda and 2 in southwestern Uganda. Just like Patrick explained before, we had really big data sets, 3,600 households at the beginning, and then we followed these up over time until 2016, and we had overall about 12,000 children that were below 5 years of age. Next slide. So I would not want to get so much into the, because of time and so on. I mean, I would never discuss all the results and get them out of here, but my interest in this presentation is to try to explain some of the lessons that were learned doing the work, but then also, of course, with the study findings. So I'll start with the study findings. First and foremost, we find that based on our analysis, these multisectoral programs, just like the Uganda Community Connector program in Uganda, can potentially improve the health and nutrition outcomes overall for those vulnerable populations. In our analysis, we found that there were marked improvements in food production diversity in terms of the number of crop species, but also animal species that were being reared by those households that were involved in the program compared to the households which were not enrolled into the program, or the communities that were not enrolled into the Uganda Community Connector. And because of this improved food production diversity, then it led to improved dietary diversity for women. And there were also some positive indicators for health-seeking behaviors in terms of access to antenatal care practices, using mosquito nets and so on and so forth. And what was really also interesting, among others, was that the rural financial services were also very important, as in households or communities which had access to the Community Connector, were enrolled in the Community Connector, had much more credits and saving services available to them. So all these seem to be, the intermediary indicators in our pathway to improve nutrition and health. But if we can be able to see these, then we are likely going to have, improved changes ultimately perhaps in the nutrition outcomes. Going back again, going into the nutrition itself, the indicators for nutrition like child stunting, maternal and child, anemia rates and so on, we really did not find very significant results. And we could say maybe the time of intervention was fairly short. You just imagine about 3 years of real actual work, because you have the first year where people are planning, doing the needs assessment, what exactly should be applied where, given the fact that this is a multisectoral sort of like program requiring lots of people and lots of, personal sort of like technical abilities, different and various technical abilities that are required. So we only were able to see that maternal anemia reduced by about 8%, which in any way is not small given the amount, the level of maternal anemia that we know exists in a country like Uganda, but also in other countries. So we think that if there were long-term interventions, beyond that, really well planned out and much more intensified and given wider coverage, then perhaps would have seen much more significant results in terms of the ultimate nutrition indicators. So, and we also, when we tweaked the data a bit and we looked at the different package combinations, different packages of implementation, we found out that when you combine selected interventions in agriculture, WASH, and nutrition, then they led to a bit much more impactful results. Next slide. So then there were also those lessons that we learned during the implementation. For instance, what did the community connector, FHI 360, what they go through? We found out that it's actually doable because they were able to do it and in the time that was specified. But then we also found that you'd need to have multisectoral personnel, people with broad range of technical abilities, but also the willingness to adjust for some individuals and systems. That you don't always get it, but when we started in 2012, it was a bit difficult even within government. But over the last 1 year that I've been working with government, that has shifted a bit. We really still need to do a little bit more, more work in terms of getting the multisectoral approach into perspective. And of course, there are hundreds of possible interventions. And at the beginning, while also while during the progress of implementation, the challenge has always been which behaviors and technologies should be prioritized and what kind of tools should be used to promote them. And that's essentially what our implementation research would be helping do. On our side as researchers, attempts to assess impact were never easy. It was quite complex and very challenging. We had lots of fidelity issues with implementation because in some communities, there were different packages as than originally, from what we had originally discussed or planned. And then some others had like partial interventions because of several other reasons that you can imagine, political interference, weather changes, access problems, and so on and so forth. So these are issues that come up when you're doing the evaluation like this, but then we had, of course, a very good team to go around and make sure that, we can be able to get some lessons, especially regarding the research products and stuff like that. Next slide. And this is essentially my last slide. And to be very honest, and I think everyone here in this room knows, but perhaps some other people outside do not know. And that's the message that we need to go them. The governance systems and those who are leading us in these countries and other places where, they make decisions what kind of research to make. The demand for data and information on similar relationships is enormous. I think we only did like a drop in the desert, a drop of water in the desert, and these research gaps are immense, and we need to get some more of these studies ongoing. Collectively, as researchers, we were building knowledge around the community connector programs, and we wanted to explore some scaling solutions. But of course, and this is very important, and we have done some bit of work, and we could still do similar work, including where government actually does the implementation. In our work, and in my understanding, is that we were not really able to do the job well in terms of giving feedback to the community connector implementation at that time, And certainly in future, then that should be something that can be focused on. So say having the research itself, very well integrated with the community connector, sort of like similar programs. And unfortunately, this does not only happen for the community connector, but there are also other reasons why things like this did not go on. And my last point is that the legacy of written knowledge, telling the stories, is important for us as researchers to invest in. It's also important to put publications out there then so that you can be able to allow other people to learn, to get governments to appreciate that work was done. But it's also very important to really break down these messages into small digestible formats like policy briefs, handouts and presentation. One of my best experiences has been whenever we do the work, not so many researchers do this really, but whenever we do the data collection and every study round, we go back to these districts and we disseminate the results. We lower our gaze, we really take down, the language and so on and so forth, and we explain to the people. But the feedback has been very positive. We are appreciated by the technical and the political wings of local government in those districts and sub-counties we've been in. And as a result of that, we were able to understand much more about our research, and we generated new insights, and of course also initiated new debates. So for us, in a way, because I think Professor Bashasha is online, and we had some people from Tufts who came here, and we had some of these disseminations, you could really see how people were very much interested, and they were inviting us to come back and design with them, the nutrition packages that they should be able to implement, to influence budgets and work plans and so on and so forth. So for me, I think that has been like the best thing that we ever did. And I thank the Nutrition Lab and USAID for funding us and for giving us this opportunity. I will stop here and I will end by thanking all the people who have been involved, including, the local governments, the people who are helping us in the field workers, of course, without forgetting to mention a lot of backstopping we received from our colleagues up in the north. Thank you.
Thank you, Nassul. And I will, without further ado, two things: pass the virtual mic to Sonia, to Dr. Zaharia, and to encourage people to put any comments or questions in the chat. We will have a question and answer session for about 17 minutes after the last presentation. So Sonia, over to you.
Thank you, Bea. Thank you for the generous introduction, and thank you, Nassul and Neena, for your presentations. Hi, everyone. Thank you for joining this very special event. I'm really excited to be a speaker today, and I'm grateful to the organizers for inviting me. So in the next 10 minutes, I want to talk about, and actually I want to try to convince you about the empirical benefits of longitudinal data in nutrition. So I will give you brief insights into a few of the projects that I worked on at NIL. All these projects have been using the strengths of longitudinal survey designs. Next slide, please. So when I came to NIL, that was about 3 years ago, most of the hard work of data collection and data cleaning was already completed. So I had the luxury to be allowed to work with some amazing data sets. So there were panels and birth cohorts with very comprehensive information for thousands of households, women and children that had been surveyed over multiple years. And we were able to use this data in different projects, and I will only focus on some of them. So in what follows, I will talk first about the method that we developed to measure resilience. And then I will briefly show you 3 different empirical projects that looked at how young child growth and development are related to their past food consumption. Next slide, please. So I will start with resilience measurement. And I know that the concept of resilience has been used for quite a while. There are many ways of defining resilience. There are many definitions, many methods out there to measure it. And what we focus on what we use as a starting point for our method is the definition of resilience as the ability to bounce back or to recover after an adverse event. Next bullet, please. So we are focused on those who experience a decline in the first place and subsequently recover at least part of what they lost. Next bullet, please. So to observe this, already to observe a decline and a recovery, we need to have data on at least 2 subsequent changes. So we need at least 3 points in time. Already here, panel data is very useful and necessary, in fact. But let's say we see in our data a decline and then a recovery. Can we, by seeing this, say that we have here resilience? Next bullet, please. What if the pattern that we observe, what if the changes that we have observed are actually part of a pattern? What if we actually see just noise in our data? And this is a problem because there is a lot of measurement error, for instance, in nutrition, and not only in nutrition. So there can be noise in the data. So our idea at NIL was to develop a method to measure resilience that explicitly distinguishes true recovery or resilience from such random fluctuations. And this method that we developed can work as soon as we have panel data with at least 3 points in time. Next slide, please. So we have already applied the method to a few data sets, to panel data from Nepal, Bangladesh, and Uganda. And the first results look promising. We were also able not only to apply the method and measure resilience, but we went further and looked at how resilience varied across geographic locations and between households with different characteristics. For Nepal, we were able to do this. And we are excited about other data sets and applying the method in the future. Next slide, please. I will now focus on 3 empirical projects that have used different longitudinal data sets, either birth cohorts or panel data. So what I will focus about in these projects is how they use longitudinal data to answer the question of whether there is a relationship between child growth and development and their diet in early life. So by diet in early life, we mean either animal source food consumption or dietary diversity observed at multiple points in time, starting at the age of 6 months when complementary foods are introduced in a child's diet, typically. And then we look at outcomes such as stunting, cognitive scores, and Z-scores at the age of 2, and in one case, up to the age of 5 years. So why, just before I start showing you the results, why is longitudinal data here useful? Well, a diet of a child or of any person today can have lagged effects. It doesn't necessarily have an instant effect on any outcome of growth or cognitive outcome, but it can be a lagged effect. And this is why it's really useful to see diet over time and not just a cross-section. Next slide, please. So in the first project, which uses panel data from Nepal and Bangladesh, we looked at how sustained consumption of animal source foods was related to stunting. And we found that children who consumed at least 2 animal source foods in the past in Nepal, or both in the past and contemporaneously in Bangladesh, had lower rates of stunting. In Nepal by up to 15%, and it was highly significant. Next slide. So in another project that uses a birth cohort from Banque, Nepal, my colleague Ashish Pokharel looked at, among other things, looked at how children's cognitive development measured by a cognitive score was related to their past diet. And one of the findings was that children that had a higher animal source food consumption cumulatively between 6 and 22 months had higher cognitive scores at the age of 2 years. On the next slide, in a third project, a colleague of us, Lauren Thompson, looked at panel data from Bangladesh, and she didn't look at animal source foods. I mean, what I'm showing you is not animal source food consumption, but dietary diversity in this case. And she found that children who consistently consumed at least 4 food groups in their daily or weekly diet across all the survey rounds had a higher height for age z-score and weight for height z-score, weight for age z-score, sorry. Both were significant. So again, diet over time, either past or cumulative or sustained, in all these cases, seem to be related to different child outcomes. Next slide, please. So what are the lessons that I think, lessons or implications for programming from the view of an economist doing data analysis? Well, I know that, I heard that longitudinal studies are costly, so they need a lot of human capacity. They are costly in terms of money, time. However, they are possible, as the Nutrition Innovation Lab has shown over 10 years. And not only that they are possible, but they are extremely valuable because they enable us to look at change over time. First of all, to observe outcomes over time, to see their changes over time, compare changes in the population over time. And this is very useful for resilience measurement. And not only that, but we can study associations over time to look at how the diet in the past or diet over time is related to health outcomes. And of course, it's not just diet and health, but also it can also be agriculture, how agriculture 10 years ago and over time is related to diet and health outcomes. So there are really many possibilities with longitudinal data. And I haven't even talked about a project, a colleague's project who used a birth cohort, data from birth cohort, where children were followed every month from birth to 1 year old, and she was able to determine their growth trajectories. So again, very useful to observe data over time. And finally, I want to say that the models that we can use to draw inference are much more precise. We can include the fixed effects, random effects. We can control for things that are not observable if we have variation over time. And so finally, I want to thank all the people who were involved in some way or the other in the analysis, in the data collection. I want to thank USAID for the generosity to fund everything. So thanks everyone for listening today. And on to you, Bea.
Thank you. Thank you very much for 3 very thought-provoking and interesting presentations. I want to be sure that everybody understands how to put comments in the chat. you should have a Q&A function on your screen. Is that correct? And anything that you ask then will appear in our Google Doc. So meanwhile, just to kick it off, and please let me know if anyone is having trouble getting questions into the chat, into the Q&A. But one of the questions that did show up is, this is directed at Nassul, but others may have comments as well, that multisectoral programming is really complicated. And so if you were trying to do that, take your lessons learned and put them in practice in another place, how would you go about it? What would you do to kick it off?
Thank you. That's an excellent question, but I think I don't have all the answers to it. I'm sure other people would come in with several others. I think the most important thing really is planning. And in our part, as researchers, to be able to develop a good monitoring and evaluation system, just like a Uganda Community Connector had. But it's also very important that you have an independent monitoring or research system that can provide feedback to be able to track, and I think I said that a little bit in the presentation, that can be able to track what we set up to do. Is it really what we are doing? And in case we have to change, what implications does that have for the ultimate objectives or ultimate goals of the program? So, but essentially, my thinking is that we need to be planning, and we plan together, including both the multisectoral implementers or program managers or program implementers, but then also the researchers in that respect. In my understanding, at this level and at this point in time, we have a lot more to learn, and having a research arm on the implementation is really key. Thank you.
Mm-hmm. I think I'm going to just add another comment that you mentioned in your slides, that you did a lot of planning and that some of the parishes ended up with completely different packages from the ones that you had originally intended.
Yeah.
Is there a lesson in how you can control, or can you talk a little bit about how that happened and how you would forestall that?
Yes. So thanks again. Another excellent question. So if we did not have a big sample space, we would have a little bit of a problem. But then we had a big sample space in terms of where the implementation was being done. And then we also were collecting a lot of data, such that in some communities where this did not work, we really didn't lose out. We were still powered up to do our evaluation. Now, on the other part is that there were a little bit of a glitch between the researchers. We were taken as independent people who were like policing at some point. And that's sometimes the error that the implementers make. They think that you are there to police what they're doing, but apparently that's not what we're doing. So all in all, at the planning phase, we need to really draw up and put a plan in place, a strategy in place to make sure that the implementation research is working alongside, and it's acceptable to work alongside the programs. Thank you.
Thank you. So a couple of questions have come in for Neena. So you'll have to unmute yourself when you when you answer. But a couple of things. One is that you had mentioned that in some cases the partial intervention actually had a negative impact, from which I think the understanding was that partial was worse than nothing. And it would be interesting to hear you talk about what you think the reasons might be for that. And a second question is, has Heifer taken the lessons from one country and been able to apply them in other country settings? You had some studies in Nepal. Were you able to apply those in other countries? So 2 different questions for you, Neena.
Thank you. Very excellent questions. The first one around negative impact on partial studies and partial interventions, like that was a surprise for us too. Mm-hmm. And some of the areas that we saw negative impacts was around child development. So we didn't have enough data to answer the question why. But we hope to be able to look at in a deeper level. But that was a surprise to us and an alarm also to a message for programmers that a program halfway done is better than not doing it. So, but again, like this particular study with the data that we have, they do not answer the question why. The next one, like around the learnings, yes, definitely we have in Heifer, like we have a very strong this cross-sectional learning across the countries. And the first, like there's several avenues where we intentionally share the learnings where we bring learnings from a country to others. And there are several evidences, and all the learnings go back into new program design or improving the current programs wherever it's possible. So that does happen continuously. Thank you.
Thanks. There is a question in the chat for Sonia. I'm not sure that it's both a question and a piece of advocacy, I'm going to say, but I'd love to hear your comments, Sonia. The question is, do you think you could argue that in the end, longitudinal studies are costly, but in the end, it costs more not to have longitudinal data because it's not possible to measure outcomes without them. And so we may be spending money and resources less effectively by not having longitudinal data. So I wonder if you would like to comment on that balance between having longitudinal data and what the alternatives might be. So you have a chance to make your case, Sonia.
Yeah, I mean, I feel like I said, it's also advocacy in the sense that it almost answers the question. I can't say no to the question, right? So yeah, I mean, of course, I agree. I partly agree, let's say, because I mean, clearly it's useful to know what you're doing before investing in a program, right? And that means that you need, I don't know, like we need some research behind it. And as I presented, longitudinal data helps us in understanding much better certain relationships and measuring resilience. So yes, but yeah, there are trade-offs. I mean, longitudinal data collection costs money, but also costs time. And I mean, here it was a 10-year, I mean, almost 10-year massive work of data collection. So let's say in times of a crisis, given that I spoke about resilience, you might not have time to collect longitudinal data and need to intervene right away. So yeah, I guess what can you do? I mean, it's better to do something than wait in some cases. Yeah, that's what, I don't know, the first counterexample that comes to my mind. Yeah, the time component, which we don't always have the luxury of time. But yeah, I mean, it's also, there are many criticisms to all these interventions that cost so much money, and in the end, we still have crisis when there is a climate shock somewhere in I don't know, in Africa. So that that asks whether we know well where to intervene and how to intervene. So more data, better data, and more research will be very helpful.
I'm going to take the liberty of drawing from your own presentation, Sonia, to underline a couple of things that I think are relevant to this question. One is that you specifically mentioned the issue of lagged benefits. So if you do a study a year or so, you do an intervention and you do a study to look at the impact. Did we reduce stunting? Did we reduce wasting? Did we improve wealth or something like that, you may be missing really significant benefits that simply don't show up. And actually, Neena, I think you showed some of those lagged results in your own presentation. So some things that take time to be, so you may underestimate benefits and underestimate sort of those multiple pathways for achieving those benefits without the benefit of longitudinal data. And again, I'm going to take the liberty of saying that I think another important thing, and it was a question that I thought was worth sort of posing, is when you do repeat cross sections rather than longitudinal data, you may miss the fact that some beneficiaries have simply left. Populations have changed. Mm-hmm. So if you're following the same cohort or you're following the same individuals, even better, then the cost is very high, and the benefit is that you aren't seeing that there were people displaced and new people coming in or something like that. So I think that the arguments for longitudinal data really have to do with understanding the full benefit and the pathway, since we know some things just simply take time.
Yeah, absolutely. Yeah.
And I don't know if either Nassul or Neena would like to add their experiences or comments on that.
No, I mean, just go fast. I mean, I think you're absolutely right. It's expensive to do, for instance, panel data household collection, or even to do birth cohorts, for instance, like the one we did in Uganda. But then the benefits, are many, and you are able to look at the same individual through a period, maybe even through a cycle, and that's much more informative and can be able to capture these other things, like, for instance, the influences like which were presented by Jerry in the first session, the previous session, on environmental issues and things like that. If you do, repeated cross sections, we always have problems with that, and it's not always very easy to, for instance, to combine data and look at it from the community level, so that you are able to look at what happens at the community and then be able to attribute it to a certain cause and then maybe see an effect. That's what I would simply say. It's expensive, but then it pays off. Thanks.
Thanks.
Yeah, and Nassul, just like I want to follow up, because I felt like you sometimes said you didn't find anything, and it almost feels sad, but then I'm thinking that maybe you didn't find yet because you guys left, basically. You don't know what happened later. So all these lagged effects that Bea mentioned, maybe you were just not able to observe them yet.
Indeed. And your point about resilience or noise is very relevant there. So we have 3 minutes left. And I'm wondering if I could challenge each of you, maybe in the order in which you presented, to tell us what you've got 45 to 60 seconds. What is the key takeaway that you would bring into the next iteration of any multisectoral programming implementation. Neena?
Thank you. So we have always been emphasizing that it's the people who eventually bring the change. So they are technical interventions, but when the people are not ready, that change doesn't happen, especially when we work with the people, the marginalized people. It's very important to prepare their mindset. So that's why this community development work is so important before the technical intervention happens. So I would like to reinforce, and the work that we did, the data that we show also confirm that. And when we do technical intervention, we sometimes tend to forget that human element, that it's the people who actually make the change happen. So I would like to emphasize that in all the programmings, that people element, their mental status and their belief on the change will happen, that's the most important thing to emphasize on. That's what that's what the data confirm for us too.
Thank you. Nassul, you got 45 seconds.
Thank you. I think also I would join Neena to say the same. It's the people that matter most. We do this all for the people. And if we don't get them central into whatever we are doing, then we are at loss. Capacity building is key. When we started out in Uganda in 2012, we had very few people who even understood the concepts of 1,000 days, concepts of, minimum dietary diversity. But now we have several people, working with government, but also non-government organizations who have been trained and have worked with us and can be able to, essentially discuss that. Then also in our sort of like engagement, we need to work much more with the government, because it's the government actually that finally matters. And Whale Masters have talked about governance. These things are key, and we need to give them the consideration that they deserve. Thanks.
Sonia, you got 45 seconds too.
Yeah, so to wrap up, I'm thinking that what would be nice for interventions, if the resources are available, is do the intervention and don't leave right away. Follow up. Because of the people, first of all, but also because, we want to see what happens in the long term. We want lessons for the future.
Thank you very much. No, thank you. And thank you for a wonderful distillation and a really thought-provoking set of presentations. And I think we have about a minute until the next presentation. So I would urge you all to rejoin. I am looking for what it is. So please move on to the next presentation, which starts in just a little over a minute. And thank you so much.
Thank you.